Hey everyone, it's Med Made Easy here. Today I'm bringing to you a video about pancreatitis. Now this video is just going to be a brief overview. It's going to be specifically great for if you're a nursing student or a new nurse or just someone wanting to touch up on the concept or the diagnosis of pancreatitis. Let's talk about the pancreas just a little bit. The pancreas is an organ on the left side of the abdomen. And one of its most important functions is to make enzymes, which basically help break down the food that you eat. Have separate enzymes for different things. Another one of the most important functions of the pancreas, the beta cells in the pancreas releases insulin. So anytime that you eat something, it releases this insulin. And so any kind of carbohydrates that you've eaten, ends up getting broken down into smaller components. What is pancreatitis? Pancreatitis is a disease in which the pancreas becomes inflamed. Pancreatic damage happens when the digestive enzymes are activated before they are released into the small intestines and begin to attack the pancreas. There are two forms of pancreatitis, acute and chronic. Now let's get into the quick info tips about this disease that you need to know about. Lipase level is one of the ways that we can detect whether or not an individual is in pancreatitis. Of course, with other things as well, including their symptoms and sometimes imaging. Typically, the lipase level is 3 times the normal level. Tip number 2. One of the most common symptoms of pancreatitis is left-sided abdominal pain, nausea, and vomiting. Sometimes individuals will also complain about left shoulder pain or left shoulder blade pain, pain in between the shoulder blades, and even chest pain. So if you have a patient with chest pain, it is also important to consider that maybe a lipase level should be added to the labs, especially if the individual is nauseated and or vomiting. Tip number 3. Alcohol abuse is one of the most common causes of pancreatitis. So this is one of the first questions that I ask the patient because they may also need to be treated for alcoholism as well. There are other causes like a gallstone blocking the ducts, hypertriglyceridemia, and also certain medications, which you can see this list here. This is a very important list to be familiar with. As you see, there's lots of different kinds of medications. There's a lot of different types of actually anti-hyperglycemics, diabetes medications that can have a tendency to cause pancreatitis. So anytime that before I am even starting a patient on one of these medications, I'm always asking them if they have a history of pancreatitis, and then a lot of times I may not start them on these medications. So tip number 4. These are some signs of some more emergent types of pancreatitis. They could indicate things like hemorrhagic pancreatitis or necrotizing pancreatitis, which can be, obviously, is a medical emergency, and it's important to be aware of these. I always think of the gray Turner sign as if you look on their flank area and you see any kind of bruise. This may indicate hemorrhagic pancreatitis. The moral of the story here is that if you see the Grays Turner sign or any one of these signs, this needs to be reported immediately. With the Grays Turner, they're usually going to have some bruising on the sides of their flank. So it's super important to be able to at least identify and recognize, even if you can't remember the sign, just know that any kind of bruising with pancreatitis is abnormal and that this individual needs emergent evaluation. Another sign I want to show you real quickly here is the colon sign, and it typically appears in 24 to 48 hours after someone has acute pancreatitis, and this significantly increases the individual's risk for death, almost by 40% per some studies. Info tip number 5. CT of the abdomen is one of the ways to confirm the diagnosis of acute pancreatitis. According to Hippocrates, a CT scan of the abdomen is not usually indicated in the first 48 hours from the diagnosis. CT scan with IV contrast is the most sensitive and specific study for confirming diagnosis of pancreatitis. It has a sensitivity of 90% and specificity of 100%. So this is super important to recognize. A lot of times if an individual goes to the ER, they're most likely going to be probably getting a CT of the abdomen done with contrast. Info tip number 6. You can see the basic treatment here is typically IV fluids, keeping the patient in PO so it doesn't stimulate any pancreatic enzymes any further, pain control, and antiemetics. Usually when these patients come in, they are pretty restless and having some pain, usually on the left side of their abdomen, nausea and vomiting, very uncomfortable. Another important thing to think about is what the actual cause of the pancreatitis is. And so basically, overall, these are general things that are going to be done, but we need to remove the offending agent. So whether it's medication, or it's alcohol, or if there is a gallstone that's blocking things, it's important that that be treated and taken care of. And so, in other words, if an individual is an alcoholic, we may need to put them on the seawall protocol and help them with that. There's also supplemental medications like magnesium that may need to be added for these patients as well. If the cause is gallstones, obviously we may need to have the patient be seen by a general surgeon or a GI doctor. If there's infected pancreatitis or necrotizing, they may need IV antibiotics, imaging-guided catheter drainage, or endoscopic debridement. And finally, tip number 7. Diet. Typically, the patient is kept NPO because you don't want anything that would stimulate the pancreatic enzymes. If you remember from earlier, the pancreas has this job to basically break down foods with the pancreatic enzymes and hormones. What we eat, when we eat, the enzymes are stimulated, and so this often may cause more inflammation, and the patient usually, they can tell. So when they eat, they'll often become more nauseated or even start vomiting, and the pain may increase. Well, thank you for watching this video. Make sure to hit the like button if you like these kind of videos. Also make sure to hit the subscribe button and the notification bell to get our latest videos. Alright guys, until next time. Take you